Hello, everyone. Welcome to this Instagram Live with this really amazing topic of fertility preservation. And I'm so excited to have Sofia today here with me. One second, I can see she is ready to come on this video. Let's see. Hello, hello. Here we have it. Hello, Sofia. Hello.
Hello.
Hi, Sofia.
Hi.
I'm
Hello. Nice to
so
see
happy
you.
it worked out.
Yes, so we are good. So I can see you and hear you. And I believe you can hear me and see me.
Everything perfect.
Great.
Everything perfect. I see there are already some wonderful women joining. Hello. Hello.
That's great.
Wonderful that you're here. So I haven't said anything. I haven't made an introduction yet.
Okay.
Before I introduce you, Sophia, and I'm really, really happy that you made the time to come onto this live, especially since you are a newly
Y-
mother, and I know how
Yes,
precious the time
indeed.
is. So already, thank you so much. A little bit from my side and why I'm doing this Instagram live. So, my passion is working with women as a coach and especially women in their 30s and 40s, because I think it is amazing what kind of decisions, topics we have to deal with as women in our 30s and 40s that are so
Exactly.
pivotal. So our decisions, these are really far-reaching decisions we have to take, and we can undergo so much pressure from ourselves, from society, and that's why I'm so passionate about helping women navigate these times, these years, and also help them see that there is so much learning, self discovery, empowerment in those decisions and in those years. And it's really a beautiful work. And one thing I have learned for myself is knowledge is empowerment. The more we know as women, especially over our bodies, our health, fertility questions, the better we can navigate these times. And the more informed our choices will be, and the easier our choices will be. And that's why I'm so excited to have you here on this Instagram Live, Sophia, and that we're able to talk about a very important topic, fertility, preservation, social freezing,
Thank you.
which I know a lot of my clients are thinking about, considering, or just wanting to know more. And sometimes there can be a little bit, it feels intimidating of already going to a clinic for a first appointment. So I think these kind of live conversations are really a wonderful way to get into this topic and to say, I want to know more. I maybe want to understand this direction. So thank you for the time, Sophia.
Thank you
And
very much for
uh,
inviting me. I believe it's very important everything you are doing. So I remember when we last met in Athens, you explained to me about your work, and I really believe it's very important what you are doing, and you are helping a lot. You are consulting women, not of course only for fertility, but for many aspects in
yes.
their lives, and of course one of them is also fertility. So really thank you. And as you said, I believe it's very important because many women we feel shy, or we want to postpone these things, and before going to a doctor. So I have seen that many ladies, before doing this, they are discussing with other friends that they have done the egg freezing, the fertility preservation, as we say. So I believe it's important to know some things beforehand, okay, and then take the decision on doing this, of course, back home or in another country. It depends. And why I'm saying this, because the most normal thing for somebody to do first is to speak with a fertility consultant on their home country. Absolutely, this is the most logic thing to do as a first step. But we have seen that unfortunately some countries not are open or so advanced in the services for fertility.
Yes.
So in some countries still, unfortunately, for example, single ladies cannot freeze their eggs, or even they cannot do a fertility treatment by themselves. So if they are single, for example, they cannot use donor sperm to have a baby, okay? And that is the reason that we see many women from all over the world, also couples, that they end up coming in Greece, okay? Greece, it's a worldwide destination for fertility treatments,
Mm-hmm.
not only because we have very good success rates, okay,
Mm-hmm.
and I'm very happy to be Greek and have these very good percentages in our field, okay, so I'm feeling very happy and honored for this. But of course, as I said, unfortunately, many people cannot do this on their home country, so they need to choose another country. And Greece is one of the top destinations, because not only for their good treatments and personalized treatments, but also because we have a very open law, let's
Yes.
say, in for fertility, okay,
Yes.
so somebody can do egg freezing, single ladies, and finally also women, so a couple of women, they can have fertility together. Finally, it was a big thing for us, because we were battling to do this for many years for homosexual couples. So in this moment, we can do also this. So it's very good.
Yes,
It's good.
and also in terms of thinking about the future, because I mean, many women want to use it to have fertility treatment in a couple of years. So,
Exactly.
and there are countries who have an age limit, up till what age you can do IVF treatment, and also there
Yes.
Greece is very open. It's allowed, I think, into your 50s. So
Fif-
also thinking,
54, Yvonne.
yeah,
54.
see,
Yes.
so that's and
After
some
COVID.
countries are very restrictive. So I think this is also
Yeah.
an important point when you have your life design in mind,
Yes.
um, about the
Indeed.
future opportunities.
Indeed. It's like this. So we see many countries that they are allowed to do IVF till the age of 44, I believe.
Hmm.
Um, and then, of course, a woman cannot have IVF over 44, but they need to go to donation using egg donor. But even with egg donor, they have a limit depending
Hmm.
on the country. Instead, in Greece, it was 50 years old, the limit, till COVID.
Hmm.
And after COVID, they gave an extension, and now it's still for 54 years old.
Mm. Great, great.
Yeah.
Maybe you can tell us a little bit about your background and also now the clinic you are working in?
Yes,
You can
yes,
also
yes.
say
So,
a little.
of course, I am Sofia Kasfiki. I'm a clinical embryologist. We have founded with my collaborator, Yanis Koutulakis. He's a gynecologist, many, many years of in the field of fertility. And we have our team. It's called Sillipsis IVF Group. Okay, we are based in Athens, and we have ladies and couples, as I said before, that are coming really from all over the world to our clinic to have fertility treatments. And the last years, we see, and we are happy, of course, for this because more women are asking to do egg freezing.
Mhm.
Uh, I believe it's important. Of course, we are not doing all this discussion for egg freezing, so to try and convince ladies, all ladies, to do egg freezing. Absolutely not. Okay, but for sure, having this option in mind, and the last decade, egg freezing because it's a part of fertility that has started not many years ago. Okay, so even if IVF, the first baby was born back in 78
Mhm.
in UK, and it was the first IVF. Egg freezing has started much, much later. And we have seen that the last decade, and especially the last 5 years, it has become a routine process. And why I'm saying this, a routine process, because now we have results. So we have babies born after egg thawing, okay, and eggs that they were frozen many years ago, and even 15 years ago, that the systems of freezing was totally different. It was a slow freezing. Instead, now we are using vitrification. It's a very quick way for the eggs to be frozen, okay, in liquid nitrogen. So it's very different from the first freezing processes that we were doing, and is good because already we have results. So
Mhm.
10-15 years ago, it was still under research. Instead, now it is a process that we do as a routine, and we already have statistics and good results. Okay, so it has
Yeah.
evolved rapidly the last years.
Yeah. And how would you describe the process of egg freezing for someone who doesn't know how, maybe how the preparation is, how much time you need for this kind of procedure?
Mhm. Uh, First of all, we are taking, we can, depending if a girl is from Greece,
Mhm.
we can have a first appointment in the clinic, so we can discuss everything, explain everything. And the most important is to do a scan, an ultrasound, a vaginal internal ultrasound. So Dr. Koutulakis will perform a scan to understand how are the ovaries, how many follicles we have on our ovaries. So in combination, most of the times with some blood tests that we are taking in certain days of the cycle of the woman, uh, it's a fertility hormonal profile, okay? So in combination, the scan and the hormones, the doctor can advise every woman for a personalized stimulation protocol. What is a stimulation protocol and why we give hormones to a woman to do egg freezing? Um, a very simple way to describe all this. So all women, we might have a certain number of follicles, eggs, okay, on our ovaries every month. So some women might have 10, 5, 20, 30 eggs on their ovaries every month. So the eggs we have every month, we see them on the scan, and then the next month they disappear and we have other eggs that are growing. The point of doing the stimulation is because every month our body with our own hormones has the power to make grow only one egg. So our body produce hormones, is stimulate our ovaries and try to grow this one egg. Sometimes can be also two twins, okay, but is rare, I would say. So this follicle, the first 13, 14 days of our period of every month is growing gradually every day. So approximately after 14 days, it becomes very big. So it ruptures and comes from the ovary to the tube and inside the uterine cavity. Okay, so in this path, the sperm, if there is a sperm there, most of the times we'll find the egg in the tubes and we will have fertilization. Okay, so every month our body produces only one egg. The point of giving stimulation is to try and by giving exogenous follicles, try and
The
connection is not
connection
good.
was quickly lost, but
Okay, okay. So I was saying that the point of giving exogenous hormones is to try and grow all these eggs that we have that month on our ovaries. So the day that we will arrive on having the egg collection, we try to get as possible. So not only one. That is why we are giving all these stimulation drugs, okay? To have a good number to freeze. Now, depending on the age of a woman, that is a very important factor. There are some statistics that tell us for this age it would be good to have a certain number of eggs. For a different age, another number of eggs collected. Of course, I must say that maybe it would be good for a woman to have, let's say, 15 eggs in the freezer to have a safe number. But from the other hand, if a woman has only 5 or 6 is not a problem. So better something than nothing. Okay. So this all we discuss with every woman that wants to come to our clinic and have egg freezing, and depending on the age, we will suggest what will be the ideal number for having a safety for the future. Okay.
Okay. So maybe a woman in her late 30s, you suggest 2 rounds of freezing or more eggs than a woman in her late 20s. So
Yes, indeed, Of course, there are some times that we see ladies of 39 and 40 years old having 15 and 20 eggs on their ovaries. So it will be only one time, it will be enough. Okay. The ideal age for egg freezing is from 27 to 34. Okay, this is absolutely the best age.
Mhm.
It doesn't mean that women over 34 they cannot do. Absolutely not.
Mhm.
And to tell you the truth, Yvonne, the majority of girls that they want to freeze their eggs is over 35.
Mhm.
Okay, so
Yeah.
it's more rare to see younger girls on late 20 or early 30s to come and say, I want to freeze my eggs. Most of the times, it's the age of 35 approximately
Mhm.
that women start to wondering and discussing with other friends and consulting with us. Okay, so really from 35 to 40, we still have very, very good results
Yeah.
after.
Great.
Okay.
Yeah. Yeah, because this is mostly also the age group my clients are in, and where I see
Yes.
exactly this question popping up. Because
Mm-hmm.
in your 20s, you're so busy exploring, your
Exactly.
career.
You don't even think
You
about
don't
this.
think about
Yes,
it. You don't think about the relationship is if a partner is not yet there. It's like, yes, everything will come. And so it's really, it starts around 35, what
exactly.
I see in my clients, where they say, oh, now I really have to look at this topic and I have to address it. So it
Mm-hmm.
makes total sense. And it's beautiful to hear that you say yes, and it has good results, even if
It has.
the young is ideal. But I mean, we can always just do our best. And I also see many
Exactly.
women blaming themselves for not coming earlier, doing this, doing that. And we shouldn't blame ourselves.
Absolutely
Our
not.
path is already challenging enough often.
Yes,
So to say no, we work with what we have, and we have these options now. And even in our mid late 30s, they are great option to just maybe get another couple of years to figure things out, like partnership or maybe career choices, because a lot of women I see in their mid 30s, they do a second career shift turn. So
yes,
they're starting
yes,
over, they're becoming entrepreneurs, and they need still those couple of years for themselves and for creating some stability, and often financial stability as well.
exactly.
So it's really beautiful to see also for women to, it's not too late once you pass, those.
Oh my God, no, absolutely not. Absolutely not. It's still a very good age with very good results. The truth is that we have also women over 40 to do egg freezing. Okay.
Mhm,
So from 40 to 42, we don't have an age limit. Okay. But
mhm,
I must say that over 40, things are starting to be rather challenging. Okay,
mhm,
so if we want to freeze over 40, we need to have much more eggs frozen.
mhm,
So we say that from 40 to 42, a good safe number would be around 20, 25.
mhm,
Okay, which is a lot. It doesn't mean that we have to do, maybe a girl has only 2 or 3 eggs
mhm.
on her ovaries. Okay, it doesn't mean that we will do 10 times IVF.
Yeah, yeah.
Okay, as we said, is better to have something than nothing. Okay,
Mhm,
but also the statistics give us a safe result, and
mhm,
meaning safe result, I mean a baby born,
mhm,
a healthy baby born. Okay, and I will explain what is a safe number.
mhm,
So we have seen that from 27 to 35, 28, let's say 30, 35, um, a very good number to have frozen is around 10 eggs.
mhm,
That is with one go, we might have even 15, even 20 eggs. It depends on the case. So I don't want women that they're 32 and they might have 4 or 5 eggs on their ovaries to say, oh my God, I have very few. It's not a problem because, especially in this age, the quality is still good. So it's better to have 5 eggs of this age than 10 eggs of, let's say, 43 or 44. Okay, you understand what
Yeah.
I mean? From 35 to 40 is a good number, 15, 20 eggs. And from 40 to 42, 20, 25 eggs. And why we say these numbers? Because when we are collecting the eggs, we see them under the microscope, and maybe not all of them are good. Okay, so we will freeze the good ones. So maybe you might lose one or two that they're not mature or they might be abnormal. It's something that can happen. And then you freeze them. After some years, when a lady has the need to use these eggs, because maybe you will never use them. Okay, so
Yeah.
maybe it will be something that will happen
Yeah.
naturally. But let's say in case we need to use these
Yes.
eggs, on the thawing process, we might lose some of them. Okay, so maybe not all of them will survive thawing. So it's a second step that we might lose some. And then when we thaw them and we will fertilize them, it's a big percentage that not all of the eggs will be fertilized. And then again, maybe the ones that are fertilized, they will not all give us an embryo to transfer back. Another step that you might lose some. And of course, even when we will do an embryo transfer, even if the uterine cavity of a lady that will receive these embryos is perfect, we always need some luck. Always. Okay. So we might have a negative or we might have a positive and then a miscarriage. Okay. So if you take all these scenarios, of course, I'm a very positive person and I don't like to say the things that can go wrong.
Yes.
But I have to explain why a certain number for every age. Okay, so
Yeah.
since we lose some on the way, that is why we need to have a good amount of eggs in every age. Okay,
Yes. Yes. That's really important to understand because it's not an absolute number for everyone. It's like what makes
exactly,
sense for you in your situation with your age, and to really have this individual determination with each woman. And I think this is also an important point that you're making is like, yes, we have to make the calculation. Not every egg will give us a baby. And also, what we don't know in this whole scenario is what's the part of the man because we don't know how the
exactly,
situation is there. And
exactly,
we can just, what we can do is for ourselves, our situation. And then there is the second factor coming in. And this is also something to, well, maybe it will be our partner later on. Maybe it will be a sperm donor.
exactly.
So also having your eggs frozen, it gives you also the freedom to later choose and say, well, the partner is still not there. I thought, he would be there with 40,
Yes,
but he's still not there. I have the choice to do it with a sperm donor. I have the choice to do it on my own, or
exactly.
I feel now my partnership is really strong, is the right one. We want to do it together. So you still, at the moment where you freeze, you still have the options open for what is happening later. So I think this is
Exactly.
also important to keep in mind. And so, so what is happening basically? You have the eggs frozen, and then
Hmm.
you can store them, and you can decide how long you have them stored, right?
Exactly. And this can be for many, many years, even a decade and more than a decade.
Mm-hmm. Yes.
So it's a good safety deposit, I must say. And of course, Yvonne, to add something important. Uh, of course, we do fertility preservation for social and personal reasons. Um, Things are changing rapidly on our lives, and we see men and women that they're having amazing careers, and most of the times the peak for a woman's career, also for men, is between 35 and 40, if you think
Yes.
about it.
Yes.
Okay. So it's exactly maybe the age that a woman might think of having a baby in between this peak of her career.
Mm-hmm.
So we have seen that many women trying to for a baby over 40. Okay,
Mm-hmm.
so having your eggs frozen, it's something that can be very helpful in this situation. But of course, it's not only social and personal
Mm-hmm.
reasons. Okay, or maybe you haven't find a partner still.
Mm-hmm.
Though egg preservation has started for something different. We have started around 20 years ago, 25 years ago, uh, ovarian tissue freezing, because it didn't start with eggs.
Mm-hmm.
It started with pieces of ovarian tissue, okay? And this has started for patients, for young ladies that unfortunately they had cancer,
Mm-hmm.
so they had to do to freeze their eggs before they start chemotherapy or radiation on the pelvis. Other women, this is how it started.
Yeah.
Okay. And then, of course, for many other reasons like premature ovarian failures. So we see that some girls, due to chromosomal abnormalities like Fragile X and Turner syndrome, or also due to a mother that went early in menopause.
Mm-hmm.
So now you have this option. If a girl knows it, she can have egg preservation, because we see even women of 30 and 35 years old to go in menopause and premature
Yes.
menopause. Or other reasons can be severe endometriosis, that or women that they need to have a surgery on their ovaries, a cyst, an endometrioma, or something else, that they might risk of removing also a part of the ovarian tissue of the
Mm-hmm.
ovaries, and also in cases like genetic mutation, like the BRCA mutation, that sometimes women need to remove
Mm-hmm.
ovaries. Okay.
Okay.
Um, and of course, social and personal
Yeah.
reasons. So, for all these reasons we said, we can do egg freezing.
Wow. It's so beautiful to see, what medicine can do for us. And I
Really,
really feel that we still need to do much more education for women at
yes,
an early age, because it is. I mean, many women, as you said, there are more and more cases of early premature menopause, and women they don't know. They don't know, and they come to the doctors and now I want to get started, and they
yes,
they get shocked about their numbers. So I think this should be something that we should
really,
include in conversation so much earlier. And also from my perspective, what I see happening is often women leave their career and do one transition in their early 30s, mid 30s, and they leave maybe a financially very secure environment. And then they go into entrepreneurial ventures. They have for a couple of years not so much financial stability. So also to make this kind of decision and thoughts, plan of your career strategy. So if I know maybe that I want to change my career, I want to downgrade a little bit for a couple of
Yeah,
years because I want to start a new project, maybe it is a good choice to say, while I'm still in my old career, I take the benefit of the financial security I still have. And
yes,
I also attribute this to my freedom to explore professionally later, because I mean, it is a financial investment. And if you are struggling in this period and you are in your mid late 30s, you're struggling financially because you started a new career, you're struggling because you feel like you need to make decisions on this area, it is
exactly.
a lot. It is a lot pressure. So I think it is very good to have these conversations more and more with younger women as well, and just to give them the awareness, the options they have, the support. And I think this is a very important message that we can also
It
pass to
is, it
younger
is.
women we are talking to.
And also with physicians,
Mhm.
of course, first of all, doctors that they have to do with women and cancer, uh, and they need to inform all patients, also men, okay? The same also with
Mhm.
men. They can freeze the sperm before starting chemotherapy or radiation. But general doctors and gynecologists,
Mhm.
they need to be instruct about this, because fertility preservation the last 5 years has made big steps,
Mhm.
and we have very good results, and it's very good for doctors all over the world to inform young ladies about this,
Mhm.
that
Yes. Yeah.
we have this
Uh-huh.
option. Of course, I'm saying all this, but not to convince women to do it. Okay, absolutely
Yeah.
not, because it's wonderful to stay pregnant naturally and to have a partner, to be good with him and have a baby. Okay, uh, but of course, having in mind that we have an option if
Yes.
it's not the case.
Yes.
Okay.
Yes, I think this is the key point. Having options, creating options, and the more options we create, the more peace we also get for our path and for our decisions. And also, it's a matter of having peace in relationship decisions, because sometimes we make a decision based on fear, like, I know this is not the right partnership, but I'm scared
Yes, Yvonne,
nothing
you are
better will
right.
come. And
You are right.
it's fear-based decisions. So options always, they lift the fear. They help us take the decisions which are also the most aligned with us and not the one that we take out of pressure or fear. So I totally agree. It's option, and when we have the options, why not explore them, look at them if they are the right ones, and maybe just to have an idea what are more or less the costs we have to consider for an egg freezing process. How
Yes,
would it?
they're right. And also the process, because we
Yes.
start explaining before. So let's say that a woman can have a first visit to discuss in the office of the doctor and have a scan and make a
Mhm.
plan for her treatment, or in case like many women that are doing with us, we are doing a first Skype video call
Mm-hmm.
consultation, and then we ask a lady to have a scan back home, a thorough vaginal scan. It's something easy. Any gynecologist can do it, or a sonographer. So to tell us how many follicles every woman has on her ovaries, maybe a hormonal profile, that is a simple blood test. So depending on this, we can send the plan, what
Mm-hmm.
kind of stimulation to take, and also a prescription to buy medication back home or in Greece, okay? And then a scan the month that a lady wants to start with her stimulation, with her egg freezing. She will have a scan back home on day 1 or day 2 of her period to be sure how many eggs we have that month and if there are any cysts. Sometimes can happen. It's something that in all women can happen, to have a cyst 1 or 2 times per year, okay? And it's better the month we will start stimulation not to have a cyst on our
Mm-hmm.
follicles, because it might jeopardize the results, okay?
Mm-hmm.
So if all is good, the woman will start her stimulation on day 2 of her period, and
Mm-hmm.
every day we will have an injection in her tummy. It's not difficult. They're very, very small injections, okay? So it's easy, and of course we can help with video calls
Mm-hmm.
and all this. The duration of stimulation approximately on average is around 9-10 days.
Mm-hmm.
So the first week, every woman can be on her own country and arrive in Greece after a week, so around day 7, day 8 of her stimulation, and stay for around 6 days, 7 days.
Mm-hmm.
So from a certain moment, we need to have ladies here and close monitor with scan every 2 days or every day.
Mm-hmm.
And on average, after 12 days, most of the times, so overall it will be 9 to 11, 12 days of injections maximum. We do the collection. How a collection is done? It's a surgical process, but a very simple one. It's under anesthesia,
Mm-hmm.
but very mild anesthesia, because the duration of an egg collection is around 50 minutes.
Mm-hmm.
And the gynecologist will go inside from the cervix with a very fine needle, okay? So you don't cut, you don't open, it's not a surgery, okay? So it goes in and in the ovary with a needle, and we just aspirate the follicles,
Mm-hmm.
okay? So it's a quick procedure, is not painful. So when a woman will wake, she will wake up very easily, and she can back to her life even the same day, okay? Most of the times. So if sometimes, and I believe it's right to take a day off and go home and have a rest that day, but it's easy, it's easy. So we see many women that after a collection they can return or on their everyday life, okay? uh, so it's a period of around 10 days of injections and an egg collection under anesthesia,
Mm-hmm.
and that's it, okay? The risk, uh, every procedure has some risks, okay?
Mm-hmm.
They're very rare
Yeah.
in IVF. So egg collections are, I would say, rather safe processes, okay? Um, a risk might be overstimulation of the ovaries
Mm-hmm.
if a woman has many eggs. So we see that some women that are having very productive ovaries with 20 or 30 eggs, due to many of them growing, we might have and overstimulation, which creates discomfort, so they can be bloated. But they're all a situation that if we have a personalized treatment and a close monitor, is very rare to happen. Okay. The cost is around in our clinic, let's say, is 2,500. Okay, the medication are not included, and they're not included because every woman is different, so all women have personalized protocols. Okay, the truth is that our philosophy is not to bombardize with hormones. We don't give high dosages. We believe that with a good but normal quantity of hormones, we can get all the eggs we want. So we don't like to go very hard
Yeah.
with stimulation with hormones. And it's good because if you don't give a lot of hormones, also the cost can be lower. So cost of stimulation can be from 500 to 1,500. It depends on the medication, how many eggs every woman has. Okay. And then we freeze the eggs, and there is a fee for the custody of every year of these eggs. And depends on the clinic, it's around 200 euros per vial. Every vial we can freeze till 5 eggs in each vial. Okay.
Okay.
So depending on how many vials, how many eggs we have, we separate them in vials. And this is good because when it's time for a woman to use them, there is no need to have them, let's say, 20 together, and you need to thaw all together. You can have 5 and 5 and 5, so you can thaw batches. Okay, not all of them.
Yeah. Also, in case you want maybe siblings and you're thinking of having one
Of
first
course,
and another
of
one,
course,
so
of
it gives you
course.
also this
You are
choice.
absolutely right. Yes.
Uh-huh. Beautiful. I think we covered so much, and it's really so helpful to have an idea how the process works, how also the investment is, just to give women all the pieces of information to have to say, interesting, this is something I really want to consider. And of course, then they can contact you. I will have the
Of
link
course.
also
Absolutely.
in the description below the video. We will post the video below. And I just want to also quickly mention from my coaching perspective, what I see a lot of happening with women is they are really having such a hard time of making this decision. It's like going back and forth, back and forth. One day it's yes, I think that's right. The next one is no, absolutely not. One day it makes sense. The other is like no, never for me. It really can be very a lot of pressure on a woman to make this kind of decision for financial reasons. Sometimes it can be also some ethical reason or reasons of simply, well, but I had a dream it was going differently, or
Yes.
I don't want to do anything in a clinic. So women can have a hard time. And what I see in my coaching and what I want women also to understand, it's not your fault that you're going through a hard time. It's also our brain, which is wired in a way, the more stress we add, the more pressure we add, the less our brain is capable in taking complex decisions. And this is something which many of us simply don't know, that the more we undergo a stress, the less likely it is to have really calm, far-reaching decisions where we feel grounded with the decision and where we feel like, yes, this feels right. I know this decision is, deeply aligned with me, myself, how I see my life, my future. So I think an important aspect is also to understand when you're undergoing a lot of stress and pressure, take care also of your mental well-being, your emotional well-being. Maybe also look for help for someone professional to work together with who can guide you through this situation of extreme stress and pressure and lead you to a more grounded situation where you will be able to see options and maybe also you might think in the height of the stress, this is too much investment. I cannot make it. And you won't even be able to think about maybe innovative ways of how you could make things happen or how you could make single motherhood happen. For this,
Mhm.
you need a calm mind. And you really need to understand that unfortunately, your brain is not helping you with complex decisions in moments of pressure and stress. It's helping you to survive, but it's not helping you to make
Exactly. I
complex
fully agree, Yvonne.
decisions. So
I
that's
fully
why
agree.
no shame in feeling this constant torn of yes, no, yes, no, yes, no. It's normal. And in this situation, it's really a good moment also to look for help. And when you feel like your friends are not equipped in this matter to help you, to look for professional help, to look for a coach who's
Exactly.
specialized in this. So
Exactly.
I think this is an important point to not add more pressure on yourself than you're feeling, and really to be kind to you in this whole process. And the other aspect that I think is important is the egg freezing is indeed buying you options, but it's still important afterwards to take ownership of your decisions, to take ownership of the areas in your life that maybe are not going so well as you would like them to have.
Hmm.
Maybe a relationship where your partner is not seeing you in the way you deserve it, or is not supporting your wishes and dreams in the way you deserve it. And to really take ownership of these areas and take ownership also of your health, the area of health. And I think when we talk about fertility preservation and the opportunity to become a mother in our 40s and well in our 40s,
Yes.
we still have to consider that becoming a mother is not a one-day event. It's a long process afterwards. So what we want to do is also take ownership of our health, to support our health, to be a mother
Exactly.
in our 50s, full of
Yes.
energy, because we can have maybe teenagers when we are approaching 60. So we have to be
Exactly.
completely,
Exactly.
we have to be good. We have to really advocate for ourselves. So this is something I'm also, that's my message to women. Have this wonderful option, but take ownership of the other areas of your life, because what you want is really the best possible setting for yourself, for the baby that you want to create, the family that you want to create, the career that you're creating. So these are the 2 points that I'm seeing in my coaching work and that I really find very important in this whole process.
I fully agree with you, Yvonne. I must say, it's exactly as you say.
Ah, Sophia, we said we want to make a short conversation and we're here almost
It
one
was
hour,
long.
but it
You
is
know
a
what?
long
I
one.
see, Yvonne, that Ellen is
Yes.
made a question.
Ah, yes.
How do you guide a woman considering egg donation?
Yes. So,
Uh, we might want to answer to this.
yes.
Uh, so, look, Ellen and everybody that is listening to us, the truth is that, of course, not all women has preserved their eggs.
Yes.
Okay, so due to all these reasons I said before, so maybe cancer, radiotherapy, chemotherapy, premature ovarian reserve, genetic mutation, or age, okay, because we thought about it late in life, or we found a partner late in life, or we said, okay, I will do it by myself. Some women and men, of course, have to take an egg donation or sperm donation. How we guide them? The truth is that being fertility consultants, we are a little bit also psychologists together, or coaches
Yes,
like you.
yes.
Of course, so we do a big part of
Mhm,
this consulting, because it's not always something easy to
mhm,
accept, or some women and men are shocked in the beginning, okay, because maybe they don't have idea of what is egg donation, what is sperm donation, when we can have this. So sometimes we speak with people that they hear this for the first time of their lives, okay, so it's something, it can be shocking for many people. Other people are, through time, we see that they become much more open, okay?
mhm,
And of course, other people, they're open from the beginning. Um, for us, to tell you the truth, it is good to speak also with a specialist, like a psychologist, or like a coacher like you, okay? It's really helpful, because we absolutely do not want to do things in rush.
mhm,
As you said, Yvonne, and I fully agree, we need to have a preparation of every woman, every couple that wants to do, let's say, egg donation.
mhm,
So do not jump and take a decision before thinking well, okay? So for me, it's very important the embryologist and the gynecologist that will speak, and the midwives and the nurses, that they will have this conversation first of all with a lady, and then it will be very helpful to speak also with somebody, with a consultant like yourself, to discuss everything thoroughly.
mhm. Beautiful. Beautiful. Maybe this could be the topic of another interesting live, because this is
Yes, of
so much
course, of
interest
course.
and so many questions. And
Yes.
I think also in this answer, what I hear so much in this message that you're saying, and what I also felt when we were meeting, was this: um, you have such a great respect for every woman's individual choice. And this I find so beautiful, and I really hope that all doctors would um, would work in this manner. That they say ultimately, what is most important is the woman's choice, and her decisions, and not trying to lead her in this direction or in the other direction. Um, I think, oops, I think I left. Oops, Sophia left. Let's see if we can get her again. Mhm. Let's see. I have some more questions here. Let's wait for Sophia, hopefully, to come back. But in any case, I think this whole topic of egg donation, which has also so different questions to it, could be I'm here, okay, but you cannot see me anymore. No, I cannot see you anymore. So let's see if I can. Oops, I'm sending you an invitation, Sophia. I just sent you. Ah, great. You're back.
Here I am. Yes, I'm back. I'm back.
You're back. Great. So just to finish maybe what I was saying, that I I felt so strongly your respect for every woman's individual choice. You give all the medical information, you give all the background, but you are so respectful in also respecting whatever the choices the woman is doing with all this information. And I think this is very beautiful. And sometimes in this medical world, this is not a given. And I really hope for every woman who is seeking support, who's seeking treatment, to really find exactly this respect and this openness and what the understanding and the empathy that you
Thank
are
you very much, Yvonne.
bringing to the women, because it is it's such a deep topic for us women. So
It is,
what we need is someone who treats us with sensitivity, who treats us with the respect that we deserve on this journey. And
of course.
I think, Sophia, we can really do another Instagram live at one
Yes,
point.
we can.
Sophia.
We can.
So
I really loved it.
yeah,
I enjoyed. And I believe, Yvonne, it would be nice if you can post it also,
I will post it. Yes,
because I see that many women are sending me also personal messages,
yes,
because maybe they're in a hurry now and they cannot
yes.
watch it. So they're asking me if we will post it. So it will be nice so
I will
everybody can
post.
see it on their own
I will
time.
post it and I will link you so you can also
Perfect.
share it. And we have it in our library for women to come back also when we will
Excellent.
see this video at a later point.
Perfect.
Thank you so much,
Thank
Sophia,
you very
for your
much for the
time. It was
invitation.
beautiful, and we stay in contact. And it was really so much information, so much to take in. And I'm also saying thank you from all the women in my network for whom this was really very
You
helpful.
are welcome. It was very nice also for me to be here and speak about all this. And
Wonderful.
I really hope we will have another
Yes,
topic again.
definitely, definitely. I think I saw it here in the comments already. So I
Great.
think egg donation could be the next one.
Yes, of course, of course. Why not? Why not?
Okay,
Okay.
wonderful.
It
Have a
was a
wonderful evening.
pleasure.
Bye.
All the best.
Bye.
Bye. Bye bye.